Hello,
Hi,
my name is Warashon.
and my name is Charisara.
We are patient support officers at Reassigment Clinic and Interplast Clinic in Thailand.
And now we are in Interplast Clinic in the heart of the Bangkok.
Throughout the series of our videos, you will learn about the knowledge of sex reassignment surgery or SRS. You will learn about the operations, how to prepare for yourself and your body.
And firstly, let's start with this question. What is sex reassignment surgery? Sex reassignment surgeries, or SRS, is a surgical procedure by gender dysphoria. Patient existing physical and appearance and functions are transformed into that of the gender that they identify with. But what is the gender dysphoria?
People with gender dysphoria are not comfortable with the gender they were assigned at birth. In other words, the assigned sex and gender do not match the person's gender identity. This may cause stress, isolation, and poor self-esteem. The patient will be uncomfortable with their own body, especially during puberty. In some cases, the patients cannot deal with the expected role of their assigned gender. This gender conflict can influence the person's behavior in many ways, whether dress style, way of living, and self-image. And a lot of patients find their own solution for this. Some may cross-dress, some may spend their full time living in a preferred gender, some may undergo a transgender hormone treatment, and some, of course, would prefer something more direct. And that leads us to our topic today about sex reassignment surgery.
Exactly, and I believe that our audiences would like to know more about sex reassignment surgeries, how it's done, and how many techniques are there, and what are the differences.
Well, it might be too complicated to talk about all the details at once, but let's start with the basics. There are currently 3 major techniques for sex reassignment surgery. The first one is called penile skin inversion. The second one is called scrotal skin graft and flap. And the last one is called primary sigmoid colon vaginoplasty. Now, let's talk about the characteristic of each technique. Penile skin inversion is relatively a simpler technique compared to others. The patient's penile skin is cut and inverted into create a vagina. It will take only 4 hours to complete the operation, but the length of the vagina will not be sufficient for sexual intercourse. Therefore, this technique is the least popular among all other techniques. Now, why don't you talk about the other 2 techniques?
The next one is scrotal skin graft and flap techniques. For this technique, here we call it because technique 11. There are some specific methods developed by our surgeons which give to construct vagina is more natural looking and functional as those biological women. Under these techniques, skin graft and flap are used to construct neo vagina and its components, and the surgery is lasts for 6 or 7 hours. And the last one is primary sigmoid colon vaginoplasty, or because technique 13. This particular technique is used to help patients whose penis length is too short or has been circumcised. By adding patient colon graft inside the vaginal wall, prepucial flap and scrotal skin can be effectively utilized to form aesthetic and functional major labia vaginal opening while sufficient depth is still achieved by colon graft.
SRS is a life-changing transformation for the patients. It should be strictly carried out according to the highest international medical standard at a certified medical center and strictly follow all the qualifications to ensure the success of the operation.
And these are snapshots of SRS basic information. In the next video, we will go further into the other detail of SRS, such as the character of each technique. what are their disadvantage, advantage, general requirement for the surgeries, and how to prepare yourself. And see you next time. Goodbye.
Goodbye.